Topic is about internal medicine, which is a doctor that specializes in the diagnosis of patients and helps set up a treatment plan for the patients as well. The article that I decided to talk about is called Mentoring Matters, and I used it as a reference in my research project. Mentoring during the early stages of a career has been associated with high career satisfaction and may guide development of professional expertise. Little is known about mentoring experiences during residency. Their purpose was to describe mentoring relationships among internal medicine residents and to examine the relationship between mentoring and perceived career preparation. Residency training is made to prepare young physicians for their future careers in medicine through a system that enables them to reach their personal and professional goals in service to society. This consists of hands-on learning experiences, workshops, and as well as clinical training. The question this article asks is, does mentoring matter during an internal medicine residency? The survey was designed and administered and mailed to all interns and residents enrolled in the 5 independent internal medicine residency training programs affiliated with Harvard Medical School. They examined the development of mentoring relationships during residency training and measured satisfaction with mentoring and with perceived career preparation. The final questionnaire consisted of 58 items and required approximately 10 minutes to complete. They examined the proportion of residents who reported that having a mentor was important during residency and reported either identifying a mentor or being satisfied with current mentorship. They examined the ideal characteristics of a mentor as identified by each resident. They compared residents who identified themselves as being and not being mentored, looking at differences in confidence regarding career decisions, satisfaction with residency program, and adequacy of career guidance. 329 residents responded to their survey, which was approximately a 65% response rate. Residents did not seek mentorship during residency for several reasons, including the fear of approaching a faculty member, inability to find a faculty member whom they trusted, and never having thought about approaching a faculty member. Their study also demonstrates specific aspects of mentoring relationships that may be useful to leaders in medical education who choose to develop mentoring programs for their house staff. They showed that most residents met with their mentor every 6 to 12 months, and that the majority of residents reported this as sufficient, clearly stating the expected frequency of meeting may reduce faculty concerns about the time commitment involved in mentoring. Although earlier studies have raised questions about the importance of concordance by race and ethnicity between mentors and mentees, there is no difference in satisfaction detected. The majority of mentored residents described benefits from the relationship, with 70% of residents describing a meaningful impact on professional development and 57% describing a beneficial impact on personal development. The residents also described receiving helpful advice on career decisions, 61%, clinical work as 61% as well, and research, 38%, with a smaller percentage describing assistance finding a position after residency, 32%, or guidance when facing disappointment or failure, 25%. Residency training is a period of remarkable professional growth and meaningful personal development as young physicians acquire clinical and professional skills that will help shape their future career and build or weaken important personal relationships. Recent data demonstrate that residency is associated with burnout and stress that impact not only the patient but a person's personal health. Their findings support that effective mentorship, a relationship whose value has been demonstrated among faculty physicians, is highly valued by residents and can contribute to improved satisfaction with career preparation and their experience of training. Also, mentored residents were twice as likely to have excellent career preparation. This article helped to prove the mentorship is helpful to residents and can help shape their educations and their careers. I personally thought that this would be the outcome of the study because we all know how helpful it is to have a friend, professor, or even a tutor help us understand the concepts that we are learning in our classes. Mentorship is important, and I believe that it can help within any field of work. Mentorship should be required for people beginning to learn a special skill, especially one that involves the diagnosis and treatment of patients.